Thank you, Bob, and good afternoon, everyone. Thank you for being here. CAI and First Star are here today to shine a light on what is both a national tragedy and a national disgrace. We Americans often count our blessings to live in a country where children are spared the suffering of famine, exploitation, and disease faced by their peers in many other countries around the world. But in the darkest recesses of our state's child protective systems, an alarming crisis looms unaddressed. I know you've just heard this from Bob, but it bears repeating. Each year in this country, over 1,700 children are known to be killed as a result of child abuse and neglect. Many believe the number to be well over 2,500. This is a shocking statistic and a frustrating one as well. For how can we really develop a comprehensive national strategy to address and solve the problem when we cannot even say with certainty how big the problem is? That's why we're here today. The death of an abused or neglected child signals that something has gone horribly wrong, not only within a family, but also often within the child welfare system itself. Far too often, in every corner of this country, the circumstances that lead up to deaths and near deaths remain shrouded in secrecy. In trying to protect themselves and the identities of perpetrators and sometimes other potential victims, state laws often conceal flaws in their welfare systems that contribute to these tragedies. As a result, opportunities to fix the problems are missed. CAI and First Star issued the first State Secrecy and Child Deaths report in 2008, out of the belief that the urgency of discovering the causes of child abuse deaths and near deaths trumps the need to protect the confidentiality of the state and family actors involved. We found that a majority of states fell way short of providing public disclosure information regarding child abuse deaths and near deaths, which they are required to do by federal law. The report sparked widespread public debate and attention and was a catalyst for change in public disclosure laws in more than 20 states since 2008. Today, we are proud to unveil the second edition of the State Secrecy Report, more convinced than ever that systemic problems leading to child abuse deaths can be fixed, and that children's lives can only be saved if states are held accountable for what they do and don't do through public disclosure. Like the initial State Secrecy Report, the second edition grades states from A through F based on an analysis of each state's death or near-death disclosure laws and policy in all 50 states. As a former teacher, I can tell you that assigning grades is very effective in getting people to notice whether they've done poorly, whether they've done well, or whether they linger in the middle. We found that since 2008, 11 states acted to significantly improve their public disclosure laws and policies by making them mandatory, more enforceable, more broadly applicable, and more specific with regard to the types of information accessible to the public. We don't want a state statute that says the states may release information about a fatality or near fatality. We want the statute to say a state must release information about fatalities and near fatalities and provide information such as the age of the child, the gender of the child, where the child was living at the time of the fatality or near fatality. Were they living in foster care? Were they living in a residential facility? Were they living at home? Were they living in a mental health facility? We want to know the cause of death. We want to know how many previous interactions there were with Child Protective Services, how many reports were called in on the perpetrators or the parents if they were the parents, how many times was CPS alerted, how many times did they act or not act, what kinds of preventive services did they provide for this family or fail to provide for this family. This is the information that can help us learn what went wrong, where the system is broken, and how we can fix it. We tip our hats to the states of Utah and Pennsylvania, both of which got Fs in 2008, but now have As. Pennsylvania, in fact, got a perfect A+ score this time, as did the states of Arizona, Indiana, and Nevada. You can see how the states changed their scores. I know the print is small, but the poster over there indicates how the states did on the first report and then subsequently on this report. These states that now have A's now serve as models to the rest of the nation on child fatality and near fatality reporting. It can be done. It can be done very well, and it can be done even in these difficult budgetary times. While we are pleased with the advances several states have made, others have a long way to go. 3 states, California, Connecticut, and Delaware, have actually reduced the transparency of their child abuse and neglect fatality reporting laws, and several others received the same low or mediocre grades that they received in 2008. There are still 20 states that rank in the C range or below, including the 3 most populous states of California, New York, and Texas. Colorado, Delaware, and New Mexico are in Ds, and Montana remains the lone state with an F. Although all states now have identifiable public disclosure policies on the books, not all have policies pertaining to near fatalities, which they are also required to report on by law. And while a number of states practice more transparency than their statutes indicate, there is no progress if it's not codified in statute, because policies as opposed to laws can be undone by politics or new administrations and don't take as long to get changed. Public disclosure of the most tragic cases is a necessary step towards fixing the problem inherent in our child protective systems. With this report, CAI and First Star are providing state advocates, policymakers, and whistleblowers, and hopefully some of you in this room, with the tools needed to shine a brighter light on the system's failures and be armed to make effective change. Until all states have required the release of accurate and unfiltered information in a timely manner, according to their obligation under the Child Abuse Prevention and Treatment Act, fault lines will persist in our system, and we will be ill-equipped to repair them. As Bob mentioned earlier, states are required to have these laws as a condition of funding, and after the release of our first report in 2008, advocacy groups, including a wide swath of organizations under the National Child Abuse Coalition, lobbied the Senate and the House to amend CAPTA to strengthen the reporting requirements. Although those amendments were not adopted into CAPTA in 2010, the Senate Health Committee issued a report to the Department of Health and Human Services that accompanied CAPTA and instructed HHS unambiguously to issue regulations in order to clarify and strengthen the report language. HHS has not done so to this time, and has made it abundantly clear that they have no intention to follow congressional direction in this regard and issue those regulations. Additional tools to address the heartbreaking issue of child abuse fatalities would be provided through passage of a new federal law, the proposed Protect Our Kids Act, that's been introduced by Senator Kerry. This bicameral, bipartisan legislation would be the linchpin of a comprehensive national strategy to address the current crisis of abuse fatalities and near fatalities. Among other provisions, the bill would establish a commission to develop national standards for reporting, providing the ability to more accurately measure the scope of the problem and obtain data that can be used to catalyze reform. My colleague Kim Day will be speaking more about the Protect Our Kids Act. I want to thank Senators Kerry and Collins and Representatives Doggett and Crowley for their leadership on this issue and for sponsoring this important legislation. At this point, it is my honor to pass the microphone to Danielle Jennings, who can speak to the importance of this report, this legislation, and these issues from the unique perspective of someone who has, tragically, experienced the flaws of the system herself. I will be happy to answer any of your questions about the report specifically after we're done here. Thank you. Yes.
Okay. Before we hear from Danielle, we're going to hear from Betty Krupa. She's the legislative correspondent in Mary Lander's office. She works on foreign policy and on child welfare issues. She should be very